Welcome to Spine and Sports Therapy. My name is Dr. Matthew Brackney. This is Robin Clark. Today we're going to be going over our functional re-education process. Specifically, we're going to be doing the muscle rolling component of functional re-education. Muscle rolling is so key. It's so important for our bodies, for our joints. Muscle rolling helps to keep our muscles elastic and moving. It also helps to keep our joints loose and moving well in addition. So today we're going to be going over what that routine looks like, what we'd be doing here in the office with our functional re-education routine. We're going to be doing, when we do these types of classes, when we do these types of routines, we usually do the entire body. Today we're going to be going over part of the body as a demonstration, but know that here in the office we go over the entire body. The reason that's important is oftentimes the pain that people experience, whether it be hip pain or low back pain or ankle pain, usually that area that's hurting is what I call the victim. There are culprits that are causing that victim in other places. Sometimes a tight joint, sometimes a tight muscle. Those culprits in other places can cause tension or tightness that lead to the injury that you may be experiencing. So for example, if you have tightness in your ankle joint, that could be causing pain in your knee. And if you only address your knee, if you only stretch, if you only muscle roll your knee area, you may be missing what's actually causing the problem. And you may experience some temporary relief with the self-treatments that you're doing, but you may not experience worthwhile, long-lasting relief. When you address the entire body, when you stretch, when you do this muscle rolling part of the functional re-education system, when you do the entire body, you're much more likely to address all of those culprits that are causing the pain. So we're going to go ahead and jump right into it. We're going to do a segment of what we do here in the office to give you an idea of how we do this, so we can keep that pain away. Not just get you out of pain, but help keep you out of pain. So we're going to jump right into it. Robin, we're going to start with this is a lacrosse ball. It's a great tool. Place it on the bottom of your foot. We're going to start with the bottom of the foot. So we're starting here at the bottom of the foot. Again, this is the foundation of the rest of the lower extremity. We start here and work the bottom of the foot. Go ahead and get the other side as well. So you can see that we start right here from the bottom, and we're going to work up to the ankle, shin, calf muscles, then to all of the thigh muscles, eventually up to the hip and low back as well. Again, our goal here is to address the entire, what we call kinetic chain. That's the idea that all of the muscles, though they may be called different names, they're very connected. When there's tightness in one of them, it can cause tightness in another one. Perfect. Go ahead and bring that ball to the side. Go ahead and work on those shin and ankle muscles. So now we're working here on the front shin muscles, the outer ankle muscles, all important for ankle mobility, the ankle muscles and joints. Go ahead and work around to the calf. We always work both sides of the body when we do this. For the purposes of this video, we'll just do one side to show you.
This feels good.
Go ahead and tell them what it feels like.
I like it. This one's my favorite. It just feels, it feels a little tickly to me. I mean, that's the way I describe it, but it feels releasing, like a massage.
That's so good. Like. Yeah, a lot of people that I work with say it feels like a good hurt, where they can tell that it hurts, but they feel that they're releasing something, that it's working, that it's moving the tissue aside. Go ahead and bring around to those inner shin muscles. Let's show everybody this side.
Now this one kind of hurts.
Okay, this hurts a little bit more.
Just a little bit more.
So this is another value in doing this type of muscle rolling and doing the whole body. You get to assess and feel how different areas of your body are more tight than the others, and that's really important. We'll go ahead and move up to the hamstring muscles. So you can see how we started at the foot, we worked to the ankle, now we're up to the thigh muscles. Mm-hmm. To get even deeper, you can straighten out your leg as well while you're rolling, just like that. Very good. How's that one feel?
I like this one. feels good.
Right from the hamstring muscles, you can go ahead and get the inner thigh muscles, just like that. So she's starting here on the right next to her knee on those inner thigh muscles, then working up to the groin area. Very important muscles for the knee, for the hip, and for the low back as well. Again, you can see how when you address all these different areas, how much it can affect the whole body. How these different areas, if they're tight in here, it can cause pain and tightness down to the ankle. So our goal here again is to work the whole body so that you can experience long-lasting relief from whether it be knee pain or ankle pain, hip pain, or low back pain. Perfect. Let's go ahead and put that aside. We're going to hit the glute muscles next. So Robin's going to sit on the foam roller. She's going to place her leg over her knee. She's going to do just a little tilt to the side. Very good. And then she's going to roll through those gluteal muscles. The glute is such an important muscle again for hip, for knee, for low back. How's that feel? Go ahead and tell them.
Wow. Yeah, it's deep. It can be intense right there. But it's one of those good pains. It's a good one.
That's good. Perfect. We'll move next to the outer thigh muscles. This is called the IT band. This is a muscle, this is a tendon that connects some of the muscles in the hip down to the outer knee. Again, very, very clear connection how if you have issues in the hip, it can cause pain down in the knee. So again, if you had pain in the outer part of the knee and you only stretched and rolled that outer knee, you may be missing what's actually causing the problem up here in the hip. That's the value again of doing, working on the entire body. That's really what we try to focus on when we do these functional re-education sessions. It's really important to work on the entire body. You can see from Robin's face that it's working. She places her knee up here in this angle so that she can monitor that pressure if it feels like it's too much.
Yeah. If it's too much, do I stay there?
If it's too much, then you can either add pressure with your hands to take the pressure off the leg, or you can go ahead and come back to it later for sure.
Okay, cool. Yeah, that was
very good. Awesome. Thank you, Robin.
Thank you.
Thank you guys for watching this. Again, we hope that you saw the value in addressing the entire body. How when you work on the whole body, that's how you can address some of these hidden culprits that are leading to the ankle pain, the knee pain, the shoulder pain, the hip pain. And when you do, you can experience long-lasting relief, not just temporary relief, not just feels better for a couple days, but really worthwhile, long-lasting relief. So thank you so much, Robin, for working with me today, and thank you guys for checking the video out.